Yeah, good afternoon, all. Thank you so much again for joining in. We are live with a very informative session today. Why I'm saying very informative, because this topic itself is having huge amount of information and research till now done across the world. And we have Sukrit and Arzu with us. You know both of them. They have already were there in the last session. Both are the founders of Cannazo India, and taking this particular domain, medical cannabis, with the combination of entrepreneurship and the scientific research background. I think that is very, very important. So, without wasting much time, I think all of you are eagerly waiting for the topic of the day, that is CBD products for neuro health, and how the wonderful herb, I will say, Vijaya cannabis, is helping in these kind of cases. In fact, I will start with couple of my clinical cases, and then maybe I'll hand over the session to Arzu and Sukrit to uh, brief you about all the scientific aspects, all the research aspects as far as this particular plant is concerned, and maybe the some information about the mechanism, how it is working, what exactly is the overall action, so that maybe both of them can throw some more information and some more inputs on that. So when I started my medical cannabis practice, I remember that I started initially for some cases of pain management, which I have seen very good results in. But eventually, when I studied about this herb, and some other cases were start coming, and specifically related to the neuro health, if I will talk about. So there are two aspects, in fact, broadly, if we discuss. One is the neuropathies, or the neuropathic pain, or certain kind of neuropathies in terms of if patients are suffering from diabetes, or certain kind of degenerations with the age. So those kind of pathologies, or those kind of cases, we have seen, at least it is getting delayed, or sometime paused also with the cannabis, the further degeneration or the further deterioration in the condition. Like I treat and I manage, I will not say treat, but I manage several cases of Parkinsonism as well. So where there are degeneration involved, where there are damage, or some that aspect is involved, then we have seen very good results with cannabis and certain other Ayurvedic herbs as well. And second category we will talk about, or maybe we can discuss, is related to some kind of psychological health as well. To that means the anxiety, stress, or that kind of psychological issues, where also we have seen it is working very good in terms of having them an adequate sleep, in fact converting the gross negativity of an individual into the positivity. They are more stable, they are more, you can say, balanced, they are able to perform their day-to-day activities, they are able to sleep well. The ultimately depression, or sometimes the anxiety or stress is coming down, or like it's almost gone in many cases. So these kind of clinical success we have seen in many cases in psychological as well as the neuropathic cases are concerned. And I recommend all of you. I have written some aspects of this in my latest book, which I think many of you have already started reading. You have, like, we are getting very good orders from all of you. Thank you so much for that love and support. And we will be talking more about that in the forthcoming sessions also with Cannazo. There will be several other doctors. They will be presenting their case studies. I will be. I will also try to compile and give you some more insights of our case in terms of a structured case study next time maybe. But right now, I think we need to take away this particular couple of points from here, and then I will hand over the session to Arzu and Sukrit to maybe talk on those aspects. That yes, when we have any case of neuropathies, or any case of maybe nerve damage or degeneration, anything. In fact, the two most typical pains you need to manage are either neuropathic pains or the fibromyalgias of the world. So these two are very typical cases where you have to manage pain, where medical cannabis is working very well. In fact, in my patients, there are so many allopathy doctors and their families are there. In fact, one of my teacher, like MD medicine, his wife is also taking medical cannabis for the fibromyalgia, and that somehow like we feel good that the teacher who taught us about the entire allopathic and his wife is in. Even they called me, then know that Piyush, I know that you are practicing and it's very good. I have seen internationally as well. So can we give to my wife? So I said yes, sir. Why not? And she's doing very well, in fact. So that kind of cases we are talking about, and definitely for the psychological health also these days. entire world is suffering from that. So if that can help them, and ultimately the goal is this particular herb make people happy. So if we are able to make people happy, I think that is one thing which we need to focus on. So I will hand over the session right now to Arzu and Sukrit for discussing some mechanisms, some entire detailed information which they have to deliver today, and then maybe we can have some more inputs. And meanwhile, I think some questions have already started pouring in. So if you have website, then please share it with me. Definitely, we will be flashing the website of Cannazo as well, and they can maybe show one slide where they have mentioned about their contact details after they will complete their session. So be remain with us during the session. They will definitely share their contact details. And our website, I think all of you are aware, indianvidyas.com, so that I think no need of introduction. So over to you, Arzu and Sukrit. Thank you. And all of you can post your questions simultaneously, or maybe after the talk also. We will take up one by one after they will complete their talk. Thank you. Arzu and Sukrit, over to you. Thanks. And thanks again for joining the session. Thank you.
Thank you, sir. So today's topic, as sir has correctly mentioned, is the CBD products for neuro health. So I'll just skip to the part where it's about a company because I just discussed about it in the last session. But just to give a quick brief, that we have a wide range of applications, wide range of products ranging from neurological diseases to cancer cases to pain management to psychiatric problems like anxiety and depression. We also have a range of skincare and hair products and also for pet care. So today I'll be talking about the remaining of our CBD products, CBD rich ones, which is Brain Easer and Vijaya Amrit. Both formulations are rich in CBD. The last session we covered CBD rich Cannazo. So starting with what Vijaya Amrit consists of. Now Vijaya Amrit is a full spectrum extract based medication which has a CBD rich extract. Now when I talk about CBD, whenever I say that there's a neurological problem, the first thing which comes in our mind is that if it's a neurological problem, there is a role of endocannabinoid system in it. So when I talk about the endocannabinoid system, the body produces endocannabinoids, or we try to, fulfill the deficiency of those endocannabinoids through these medications, which are neurotransmitters that will bind to the cannabinoid receptors in your nervous system. So now CBD appears to stimulate the synaptic plasticity, and it also felicitates the neurogenesis. By neurogenesis, I mean that there is formation of new neural cells, which explains why it has positive effects on psychotic, antidepressive, or anti-anxietic behaviors. The underlying mechanism is that, moreover, you will see there is a lot of biomarkers, present or involved in this situation. One of the main is the brain-derived neurotropic factor. ना उसके लेवल्स यूजुअली इस सीन में देखा जाता है कि कोई भी न्यूरोलॉजिकल प्रॉब्लम होती है तो उसके जो लेवल्स होते हैं वो काफी ज्यादा डैम्पेंड होते हैं. So what the medication or what CBD cannabidiol in specific does is that it will increase the level of brain derived neurotropic factor, and it also decreases the level of pro-inflammatory mediators. Now, as sir has mentioned that neuropathic pain के अंदर there is neuroinflammation. So medication क्या करेगा, जो आपके प्रो इन्फ्लेमेटरी मीडिएटर्स होंगे, आपके साइटोकाइंस होंगे, उसका लेवल वो डिक्रीज करेगा, एंड एट द सेम टाइम आपके जो एंटी इन्फ्लेमेटरी साइटोकाइनिन्स होंगे उसका अमाउंट वो इंक्रीज करता है. And that is how CBD significantly improves the neurodegenerative symptoms which have been experienced in conditions like Parkinson's or epilepsy. In epilepsy specifically, it helps with tremors. And in Parkinson's, it helps with in epilepsy, it helps with seizures, and in Parkinson's, it helps with tremors. Now, in specific, a recent study which was conducted in 2022, it has also been shown that there are significant effects on improving your mitochondrial dysfunction. This is still in the clinical study phase. So the emerging evidence suggests that जो आपका mitochondrial dysfunction होता है, because of which there is mitochondrial aryl accumulation and ROS, reactive oxygen species का production in the body, that is related to neurodegenerative disorders. So it will also help by improving the mitochondrial dysfunction. This is where Vijaya Amrit helps. It's a CBD rich formulation, 4:1. Both Vijaya Amrit and Brain Easer are in an oil based solution and a tincture form for sublingual administration. So, a recent study has shown when you give orally CBD or sublingually CBD, it's the fastest way of bioabsorption, and it will give instant relief. So when I talk about a neurological problem, when you have seizures, now it has been shown in cases that within the span of 2 to 3 days, there has been decrease in the frequency of the seizures, and over time there is a stoppage in the seizures which occurs in the body. Also, specifically in the case of cerebral ataxia, it has also been shown that due to deficiency or due to an imbalance in the endocannabinoid signaling system, आपको मोटर कोऑर्डिनेशन के अंदर प्रॉब्लम होता है. तो एट द सेम टाइम व्हेन आप एंडोकैनाबिनॉइड्स आप उसको एक्सटर्नली दे रहे हो बॉडी के अंदर, सो जो इम्बैलेंस होता है आपका एंडोकैनाबिनॉइड सिग्नलिंग के अंदर वो भी बैलेंस आउट होता है, एंड इट ऑल्सो हेल्प्स विद मोटर कोऑर्डिनेशन. In another condition, I have seen quite good results internationally and even nationally. A lot of studies have been done in autism, for which we were also covered in Times of India. So, a recent trial of I think approximately 150 patients has been conducted because autism के अंदर काफी patients के अंदर ना behavioral issues होते हैं. They have agitation. They don't know how to interact socially. उनका concentration level काफी ज़्यादा decreased होता है. So it has also been shown that there has been improvement in all these problems using CBD. Recently, a case which I personally saw was that the person, a 20-year-old child or 20-year-old male was having ASD, and उसको without CBD and after CBD जो effect दिखे गए थे, now he can interact socially very well. His body is very calm. There is no anxiety or stress in the body, and that is why we have full spectrum CBD rich extract for these conditions. Now when I talk about brain easer, now स्ट्रेस सबको होता है लाइफ में, डे टू डे लाइफ में स्ट्रेस हो गया, और मे बी यूर स्ट्रेस और यू हैव एंजाइटी बिकॉज ऑफ ऑफिस वर्क और बिकॉज ऑफ स्कूल प्रॉब्लम. सो नाउ stress ka main reason is the decrease in GABA levels. So what it has been seen that when you give CBD externally, the full spectrum extract or CBD, it helps by increasing your GABA levels. Now brain easer in specific also has a lot of other herbs. It's a polyherbal formulation based on herbs that have been used for ancient history, from ancient Hindus to modern world. So it has ashwagandha, it has brahmi, it has valerian root extract. So that is how brain easer is a different polyherbal formulation. In specific, अश्वगंधा के काफी अच्छे प्रॉपर्टीज दिखे गए हैं. अश्वगंधा का जो रूट एक्सट्रैक्ट होता है, when we use that in the formulation, it has exhibited anti-stress activity. It is neuroprotective. It also helps enhance your memory and increases your concentration level. Brahmi is reported to repair the damaged neurons by elevating the kinase activity for restoration of synaptic activity, and ultimately it enhances the nerve impulse transmission in the brain. It also has Vijaya, the full spectrum extract, which has already been mentioned. Valerian is specific, also helps with sleep issues. स्लीप में क्या होता है, मोस्टली दैट सेरोटोनिन का लेवल काफी ज्यादा लो होता है. सो इट ऑल्सो मेंटेन्स द लेवल ऑफ सेरोटोनिन एंड नॉरएपिनेफ्रिन, through which it increases the amount of sleep signals. And moreover, when I mention sleep signals, तो sleep signals के थ्रू क्या होता है, आपका जो डीप स्लीप का फेज होता है वो इनहांस होता है, एंड आपका जो REM साइकिल होता है, स्लीप साइकिल का फेज होता है, which is rapid eye movements in which you are actively dreaming, उसका वो ड्यूरेशन और स्पैन वो रिड्यूस करता है. And this is how brain easer and Vijaya Amrit helps with problems like anxiety, stress, or neurological conditions like seizures or maybe tremors, or even conditions where there are neurodegenerative problems जहाँ पे neuroinflammation होती है, neuropathic pain होता है, and जहाँ पे आप you also see that is dystonia. Dystonia moreover जो आपका oral lingual dystonia होता है, where you don't have control कि आपके lips and tongues के बीच में disbalance होता है, उसका motor coordination is not right. So this is how what we do when it comes to the mechanism of action. Sukrit, do you have something to add on?
May, that's great. You can continue.
Yeah, so this session was moreover about the neurological side of CBD, how cannabidiol helps there. And the last session we covered about how we have different variations of cannabidiol and pain aid, which helps in pain management. That's all from my side regarding the mechanism of action. So would you like to add something?
Yeah, I think very well explained and very well mentioned about all the aspects, Arzu. So, definitely, as I said initially, it is an excellent overall hub. If we understand more on this, we will explore more and more avenues. And if we talk about anxiety, stress, and that kind of psychological aspects, again, we have seen in many cases. See, ultimately, we need to understand if we are in anxiety or we are in stress or any kind of psychological health issue, if we are, so there is a some reason many times, or maybe there is not a reason, but still the overall pathology or overall mechanisms are connected. And we have find out when we do counseling, when we do discussion in so many cases, that there are some negative impacts or some kind of a negativity which is there inside, and which is leading to certain kind of these psychological health. In fact, 80 to 90% cases, we can connect some kind of a negativity or a negative personal life issue, professional life issue, or maybe some other aspects as well. And in those aspects, when we started this particular herb, this is one of the herb where the research studies are saying that it can convert the negativity into positivity also inside you. For example, there was one study where they have studied the dream patterns, and the sleep study was there, and it has been documented that the negativity of the dreams was getting converted into the positivity of the dreams. So that means that particular herb can is unable to create that inside you. Now, after like adding this, and when we have started giving to the patient, we have realized that yes, patients are getting relief from their alternate solutions of chemical based solutions, you can say, in terms of antidepressants, sedatives, so many harmful sometimes drugs they were taking, and that was having issues. The side effects were so much that they were not able to get rid of that. There was a kind of dependency. In fact, the beautiful part of this particular herb, which maybe many times people confuse when we talk about cannabis or like bhang or vijaya, so that it is kind of an addiction. इससे एडिक्शन हो जाता है डॉक्टर साहब, ये हमेशा लेनी पड़ेगी, हम इसके ऊपर डिपेंड हो जाएंगे, या कोई ये नशा है. सो आई थिंक ऑल दोज थिंग्स are again misnomers. अगर आप इसको scientifically if you study and if you deep down do some kind of your research as well, so after some point of time we can stop this. Patients are fine, they are doing well, they are out of their health issues. And if you manage and balance the entire case very well with your experience with certain other ayurveda herbs along with medical cannabis, within 4 to 6 months patients are getting a very significant relief. And after that, sometimes in maybe 6 to 8 months, 1 year down the line, we are gradually stopping their medicines also, and they are free. Many of them are free from any kind of medicines, and they are doing fine. It's just we need to handle them sometime. We need to do some kind of a counseling, or maybe any other counselor can do, and they need to also have some kind of a willpower to get healed. So all those components work well whenever you are treating a case of anxiety, stress, and depression, or maybe any other psychological health. But yes, you need to understand here that if cases like schizophrenia, if cases like where the hyperactivity is noted, there the THC should be very, very minimum or maybe negligible to start with, because that is a very important point. Sometimes in India we have full spectrum, and we are giving that to the schizophrenias and the patients where they have hyperactivities. And in fact, in epilepsy also, we'll have a different discussion and a separate discussion on epilepsy, but we need to understand that. So that aspect, I think Cannazo has some kind of versions which maybe I will also understand today. Again, that they have some, I think, CBD rich or THC rich. So just talk on those aspects also, Sukrit and Arzu today. That what kind of different versions you have as compared to other options we have in Indian scenario, so that doctors can understand more. And specifically, if they have something for those kind of patients where I was just mentioning about the hyperactivity and schizophrenia. So just tell us about that as well in your further discussion. Over to you, Arzu and Sukrit. Thank you.
Okay. Uh, so just covering to that part, Arzu, can you put it to Vijay Amrit? Yes, so basically, as Sir correctly said, in India, when we talk about the legality, also what is allowed is basically full spectrum. So you're keeping it in the range of full spectrum. What we have done a separate thing is basically in the ratios we have played in our factory, basically in Madhya Pradesh. What we've done is we've gone up till two variants. One is a 4:1, one is a 20:1. Now, again, the reason we've kept 20:1, that's moreover CBD overall. When we see the ratio 20:1, it's very stagnant, very specific that it's majorly only CBD, but very, very minimal parts which can be avoided. That amount of THC is there. The only reason for that and having that is because, again, as we talk about Ayurveda recommends the whole plant usage together, which is a full spectrum where they have mentioned also it should be THC, the flavonoids, cannabinoids, terpenes, everything. So coming to that point, yes, the cannabinoids, terpenes, flavonoids have been kept intact only in the ratios of CBD and THC. Through our technology which we are having, we've played with the ratios where we've kept it illegally in the full spectrum thing. But very high amounts of CBD and literally minute and minimal amounts of THC, which doesn't have any type of psychiatric benefits or any type of sedative benefits to the brain. So that is how we've done in Vijay Amrit. As to explain the mechanism and how it works, that Arzu will be able to tell better.
Yeah, so the mechanism part, as I have already covered, but like so has mentioned specifically in neuropsychiatric conditions like schizophrenia or you see psychosis, if you give a high THC variant there, that will not do them any benefit either. Like in psychosis or schizophrenia, one of the main hallmarks of the condition is that they have hallucinations. So if you give them a THC rich variant, it might increase that kind of a problem. But if you give them a CBD rich variant, it will act upon the exact point or exact receptor in the body, which induces these kind of hallucinations and help with these kind of problems. Therefore, it's very important that for specific indications, specifically for neurological problems, you give a CBD to THC ratio in which high CBD is there. And yes, Sukrit has correctly mentioned that it still has to be a full spectrum extract because internationally, nationally, all the research articles, they have quite well, summed up it quite well that when it comes to the whole plant extract, the effects are better than rather than just using one molecule or a synthetic molecule of the same.
Yeah, so that's basically where we're having Vijay Amrit. And Vijay Amrit also, we have after Vijay Amrit, Brain is the one which is the 4:1 one. So that is four parts of CBD, and as you can just change. So that
Yeah.
is four parts of CBD and one part of THC. So yes, that is having a bit higher content of THC also, because again it's 4:1, but there it is used majorly for when a person is not getting proper sleep cycles, as correctly Arzu mentioned. So for that, even THC is required. That is why THC has been added to that. So depending upon both where we are using it, when you talk about anxiety, stress, that time also somewhere THC is needed to calm down the brain. That is the only reason, having a combination of both, we've separated both the products with the name of Brainizer as well as the Vijay Amrit. Vijay Amrit is basically just a mono formulation which is only focused upon cannabis. Brainizer, obviously we've added other Ayurvedic herbs which again helps a lot with other things to basically back it up. And also when we talk about the research, how we've come across to those herbs, nothing has been added as per what we wanted. It's majorly when we see our website, we have very clearly mentioned each and every link. So for example, if you've added ashwagandha, what is the reason to add ashwagandha, what is the clinical study or the research behind ashwagandha, in fact for each and every ingredient, not only for brain user, rather for each and every product. If we see our website, it is very clearly mentioned. So for example, if you go on our website, type brain user, and after that you put the mechanism of action, it'll go take you to some other page, and that page where has a full combined list of all the links where the supporting documents are there, why each and every herb has been added and why it has been added in that ratio. So that is where all the medicines are made on the base of the research, so that we have always a backing, and on that basis people also have trust, doctors also should have trust that okay, this is what is happening, it is already researched, nothing is done as per just like just putting it. So yeah, that's there. Arzu.
So, Kirit, like I would request you to also explain the potency part one, so that people are aware that कितना होता है total में and कितना actually per ml या drop होता है उसका calculation.
Yeah, so I'll just explain to the potency part also. So when we talk about potency part, there are two ways how it is calculated. Now, first, which is the most common way, which is the full spectrum as we call it. There, how it is calculated is, for example, here also we've written 80 mg cannabinoids per ml. That is overall cannabinoids, be it CBD, THC, anything, overall cannabinoids. So that is how that has been calculated, because when we talk about a 2000 mg or a 1200 mg, so, for example, if you have a brain user which is 1200 mg or Vijay Amrit which is 2000 mg, in that sense, as you can just come to Vijay Amrit. So, when you talk about Vijay Amrit, there are two options. So, it will be easier for you to understand. In 15 ml, it's 2000 mg. In 50 ml, it is 6665 mg. Though the mg per ml, it is the same, because here how it is done is the amount of extract which is added. So, for example, in a 15 ml 2000 mg, 2 gram of extract has been added in 15 ml. That is why we call it 2000 mg. with when we talk about 50 ml, 6665 mg of the extract is added. That is why the same mg is called. But when we actually go to see per ml, what is the dosage, both will come to the same, which is 133 mg of cannabinoids per ml. That is one part of knowing it. That is when we see as a holistic view. Now when we go inside it, there are standards for HPLC testing. Now when we do HPLC testing, that is not something which we are currently allowed to mention on the labels, because CBD THC again has the ratios and everything is not allowed. We don't do it on the labels, but if a doctor wants, we do help him with the test report for that. So for that, we have done a test report with one of the government labs in India. There, what they do is basically of that 80 mg or 133 mg of cannabinoids, as it is mentioned here. In that 133 mg of cannabinoids, how much CBD is there, how much THC is there, that is also mentioned. So, for example, 133 mg would not be having only CBD and THC. There may be, for example, if we talk about this product, it would be having around 60%. Just giving an idea, 60% of CBD, 1 or 2% of THC, and the rest will be the other cannabinoids. There are other cannabinoids like we talk about CBG is there, CBN is there, CBV, THCA, THCV. There are more than 120 compounds of cannabinoids, everyone having a small percentages, and that is how that other 133 mg of the cannabinoids is divided. So this is how one formulation is made. So every time it is very important to know two things to do any medicine. Number one, which is very important, what is the total potency as per the extract, and second, what is the potency of that extract itself, how much CBD, how much THC, how much each and every composition it is having, and that is how the ratios are also actually devised. That is based on the extract. So also, I hope that clears the thing that you wanted me to explain.
Yes, I think that's a part where most doctors are confused over that how do we decide on the potency कि उसका exact calculation क्या होता है, because that helps with dosing and everything. And I think someone in the comment section has asked about our website details. So here it is. So you can just note down the details, or you can also contact Indian Vedas. Yes.
Yes, it is www.cannazoindia.com. And Dr. Payal had even asked for samples. Yes, we do provide samples for the doctors. You just need to connect with any of the number here, and we do provide. We have a special sampler pack for the doctors. So whatever doctor requires, we provide that along with that brochure and the recommended other materials. We provide everything together as a package, all just for the doctors free of cost. So you can let us know whatever samples is required. Shall we deliver to you?
So, Sukrit, I think couple of more questions I have seen in my inbox as well. So, one is regarding the student. Somebody has asked. See, let me also clarify and you maybe also add. See, first of all, you need to understand as a student, you can connect and you can get the information, but for the medicines, you need to be a registered doctor minimum. That is one thing. You want in your family or you want for someone, you can enroll to your connecting doctor, or maybe Cannazo already have some internal doctors as well, so you can connect with them and then take it forward. So under doctor guidance you can take for any case, but as a doctor you will only be eligible after you will graduate and you will have the registration and degree with you. That is point number one. Second is as far as these particular medicines are concerned, which I also was having this query, and I think a couple of doctors have also asked. So the legalities, the regulatory aspect, the overall ecosystem is a bit sensitive, and you must be having the approvals and you must be having all the documents with you, because earlier we got to know and we got this update that government of India or the Ayush people are they are fine with the classical, they are fine with the like Vijaya leaf extract, that kind of thing. But for CBD THC, and if somebody is discussing CBD THC, they are having issues. So on that note, if you can clarify that in your products it is mentioned CBD THC, the ratios and all. So are they approved under Ayurveda license? You have all the approvals for that, and how to understand and how to take it forward from here. That mentioning CBD THC and all that is technically legal in India right now as far as your medicines are concerned. So please throw some light on those aspects
Yes.
so that that clarification and that clarity is required. So all the clinician and all the doctor then after that can do the medical cannabis practice with confidence and
Correct.
can prescribe or recommend your medicines also.
Sir, as clearly when I was already talking about the legality, as I clearly mentioned, as you said correctly, in our box, nowhere we mention CBD THC here because we are already having a research tie-up with one of the labs. Because of that, we are allowed to know how much CBD and THC is there because of the research license. But again, as you correctly said, we are not allowed to mention it on the products. That's why if we see the box, everywhere it is written full spectrum, and we have to mention Vijaya leaf extract. We are not allowed to mention how much CBD it is having, how much THC is it containing. We are not allowed to mention that. And the COA also, when we do, in the COA also, only if a doctor requests with that certificate which we are having, on that basis, if they allow, we do share a when you talk about the CBD THC testing. Otherwise, we don't share that also. That's why if we see our website also, we've just mentioned a normal COA. Okay, fine. This is what the whole thing is. They ask us for the report. We do share the report of CBD THC, but boxes we don't mention it anywhere because right now also it is not allowed to mention it on the boxes that what is the CBD THC. It's an internal doctor where we also talk to the Ayush. They said as a information for the doctor they can know, but we are not allowed to mention it on the boxes and market it on that basis. Only to the doctors it is allowed to shown. So now as it is a platform where only doctors are there, yes, but when we see about the products when it is going out in the market, we cannot still, and whenever it goes we can write a CBD rich some spectrum because it is having CBD rich, yes, but we are not allowed to isolate. The only reason we always call it a CBD rich full spectrum, because still as per the laws we are not allowed to isolate any compound. It's only when we are doing it naturally through our filtration methods we get CBD rich or THC rich, yes, but we cannot isolate each and every compound and make the ratio how we want to do. That is yet not come under Ayush. So boxes will always mention full spectrum. It always mention the normal mg, which is as per the gram, as I had clearly mentioned. It won't ever mention any ratio, no CBD, no THC, not even any labels.
Fine, fine. I think great, Sukrit and Arzu, for this wonderful session today. Really very informative, and I again appreciate all the hard work and all the efforts you people are doing for this. And I request all of you who have joined late, just rewind this session. This was a very informative session today. I shared some of my clinical experiences, and Arzu and Sukrit added value to the entire scientific mechanisms, the research, and the legalities aspect as well. So do see this session afterwards. It will be uploaded on all our platforms on YouTube, Facebook, LinkedIn, and many other platforms. And you can connect with them. The details are available on the screen, and you can directly connect with them. They are very much ethically want to connect to the doctors, the Ayurveda doctors, allopathy doctors, and other doctors as well, so that they can ultimately benefit the patients through your respective networks and through your prescriptions in a legal way in our country. So I think we all should definitely support and promote them in terms of giving ultimately the healing to the patients, because medicines like these which the people have are very few in our country, and we need to heal more and more patients suffering from all these diseases. So thank you so much again for your time, both of you, Sukrit and Ardu, and looking forward to have you in many more sessions in future. And we'll be pitching in certain more doctors now moving forward with Cannazo. So you will see so many medical cannabis experts and consultants across the country. I think more than 50 are in our core team as well right now, who are practicing very well, and we will be gradually connecting each one of them for these sessions with Cannazo, and they will be coming up and talking about how they are practicing medical cannabis and how the things are moving forward in specifically the Ayurveda domain. So looking forward for all those sessions eagerly as a listener also, and we'll be roping in few sessions moving forward with Sukrit and Arzu, sharing my some of my case studies and my experience and journey till now in this domain. Thank you so much again, Sukrit, Arzu, and thanks to all the followers and
Thank you.
subscribers for watching us live, and enjoy your weekend. Have a great weekend ahead. Thanks.
Thank you so much.
Thank you for having us, sir. Thank you.